Last topic. So again, in the news, you've been hearing about the Affordable Care Act. Well, it turns out that the law is going into effect very differently in many states than it was originally passed, and this is because of the Supreme Court. So in June of 2012, the Supreme Court made a surprise ruling. You might remember that the whole fate of the law was up for question. Was the individual mandate going to be okay? Was it going to be constitutional? Was the law itself as a whole going to have to be revoked? Well, there was a lesser appreciated part of the lawsuit that related to Medicaid. Could states be required to expand Medicaid up to 138% of federal poverty level? Well, traditionally the states have always had a participation option and they could drop out of the program entirely, but if they participated they had to do what the federal government had set forth as the minimum requirements. The Supreme Court surprised almost everybody with its ruling, which kept the rest of the law intact but said Medicaid, at least as expanded under the ACA, is now also an option. So what this means is that states essentially have three options. They can drop out of Medicaid entirely. No state is seriously considering this. They can do the ACA expansion up to 138% of the federal poverty level, as we've been discussing. Or the third option that the Supreme Court created was keep your old Medicaid program. You can continue to do what you were doing prior to the ACA, but you don't have to expand to 138% of the federal poverty level. And this has had a huge impact on the way that the law is going to be implemented across the country, because this is a big chunk of people, in particular low-income childless adults, that are not going to be eligible for any coverage in a good number of states. So if you were running a state and you had been given the option by the Supreme Court to whether or not to expand, what would you do? We looked at some of the statements that have come out of the governors since the Supreme Court ruling to get a sense of how they were approaching this argument. What were they arguing in favor and against expanding Medicaid in their state? And what you see from the governors is that on the top part of this table are those who came out very clearly after the ruling and said, we oppose expanding Medicaid. And the main things that they focused on, they said they were worried about the impact on the state budget. Well, why would they be worried about that? I told you that Medicaid was going to be paid 100% for newly eligible people by the federal government. Well, there are two issues to deal with here. One is that 100% rate will decline to 90% in the long run. And in some states, even that 10% share of costs, if it's a lot of people, could be a significant burden. The other factor relates to people who are eligible in the first place but had never signed up. And if they come into the program because of the expansion, better PR, they're more aware of the options, streamlined enrollment, well, those people are still the state share at their old match rate, sometimes up to 50%. So because of those issues, some governors are quite concerned about their ability to afford this over time. The other issue that was commonly cited was that many states opposed more federal oversight. They didn't want a program that had greater federal involvement with more regulations related to the Affordable Care Act. As you might imagine, a lot of these arguments fell out across party lines, with mostly conservative governors saying they really did not want to have more federal involvement. If you look in the middle of the graph, or the middle of the table, we see those governors who came out early and said, yes, we're in favor of expanding Medicaid. And their answers probably won't surprise many of you. The first one focused on that this is an opportunity to really improve care for people who don't have health insurance now. There are millions of people who are low income who are not eligible for any kind of coverage right now in the U.S., and the Medicaid expansion is a key way to get them more access to services, as we've seen. In addition, a lot of the states expanding Medicaid were already doing something along these lines. They were using state money to cover some low-income childless adults. They had done some partial expansions of Medicaid before, and this now gave them the opportunity, with very generous federal funding, to increase coverage in their state, bring federal dollars in that will go to their hospitals, their doctors, and their other providers. So one thing you might think is clear from some of the previous discussion, though, is anyone getting Medicaid is going to be better off for it, right? Well, it turns out that this is actually part of the debate as well. Governors in particular in several conservative states have argued that Medicaid's ineffective, and in fact that it's bad for people. And we see here one representative headline from an editorial in the Wall Street Journal when this debate, even before the Supreme Court ruling, was already starting to kick up. And the conclusion, or the article, claimed that Medicaid was worse than no coverage at all. Is there any truth to this? Well, let's talk briefly about where this might have come from. And you're going to hear a lot more about this with Dr. Baker in the next session. These studies largely look at comparing people who have Medicaid versus those who don't have Medicaid. Well, I told you that Medicaid is basically targeted to cover the poor and the sickest of the sick. Would it surprise you if I told you that they also have worse health outcomes? A lot of these studies have basically concluded that people who are in Medicaid do have worse outcomes. The mistake is to think that it's because of Medicaid. And so when we do more rigorous studies that look at people who go from being uninsured to gaining Medicaid, we can gain much more insight into what their coverage is actually like. And two studies that I'll briefly mention here. One study looked at 3 states that essentially did the ACA expansion a decade early. They decided to cover low-income childless adults who were below the poverty level. And this was a big expansion in Medicaid, with 500,000 people total over 3 states gaining coverage. And the study showed that compared to neighboring states that didn't expand Medicaid, the populations in these expanding states experienced fewer cost-related barriers to care. They described their health as being better, and the mortality rate in adults 19 to 64 in these 3 states declined compared to those states that didn't expand. Oregon provided us a natural experiment you're going to hear much more about from Dr. Baker, and in this state they also expanded Medicaid to childless adults. And there they have detailed level data on individual people. And again, they find better access to services, more preventive health services. People feel better about their health and say their health has improved. Whether it affects some of their chronic diseases, that's been less clear, and you'll hear again more about that. So where does this leave us? Overall, we know that states are balancing their cost concerns and federal concerns about oversight, along with the potential benefits to their population and their state economy of bringing in these federal dollars. Well, as of now, about half of the states have said yes. 25 states in the District of Columbia are expanding right now in 2014. There are several states that are still on the fence and are actively considering over the next year expanding. And as you'll see in the slides to follow, many of them are taking this as a chance to try to negotiate the terms of that expansion with the federal government. But this still leaves about 20 states that are simply saying no and don't plan to expand Medicaid over the next few years. The implications here are quite important because the Affordable Care Act was designed to cover people who are above 138% of poverty in the marketplaces. The people below that were supposed to get Medicaid. If you're a low-income person in Texas below the poverty level, you simply have no choice. And so you have the irony, which is tragic, that people whose income is too low are the only ones who don't have an affordable health insurance option. So finally, in thinking about the states as they consider their expansion, some of them have begun negotiating different approaches to Medicaid or different approaches to coverage entirely. And this is an opportunity for them to try to come to terms with CMS and the federal government to say, let us try something new in exchange for our agreement to expand. For instance, Arkansas and Iowa are going to be using Medicaid dollars to purchase private insurance. So someone who would qualify for Medicaid in these states instead will get that money sent to a private plan that they pick out in the marketplace. It remains to be seen whether this improves their quality and access to care. It's an important experiment for us to follow. It's also unclear if this will cost more or less or the same. These are key questions for us to study going forward. Other states have taken the opportunity to try to change their cost sharing and charge more copays, higher copays, charge premiums in some cases, especially related to health behaviors, telling people that if they are willing to try to lose weight or quit smoking, they can get back some of their premiums. Again, these are interesting, innovative ideas that have both potential benefits and potential risks if they drive people out of the program or keep them from getting care they need, and will need to be followed closely. So expect these negotiations to continue as states and CMS explore their options, and as more and more of the states that are not yet expanding at least consider that option going forward if the expansion proves successful in other states. So 2014 is a big year. Stay tuned. So that's the end of our talk on Medicaid. I really appreciate your time and hope you learned something and enjoyed it too.